evening, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to our special panel discussion on Ask About Alzheimer's, organized on the occasion of World Alzheimer's Day 2025. Today, we all are coming together to shine a light on one of the most pressing healthcare challenges of our time, Alzheimer's disease and dementia, condition that not only affects our patients but also deeply impact families, caregivers, and communities. This is a conversation about awareness, early action, and most importantly, hope. And in this discussion, we aim to answer some of the most pressing questions around Alzheimer's, debunk myths, and discuss solutions that can make a real difference, both for those living with the condition and for those caring for them. And today we are honored to have with us a distinguished panel of experts who have dedicated their lives to advancing neurology and dementia care. Let me take a moment to introduce our speakers. Dr. Professor Manmohan Mehndiratta, Principal Director and Senior Consultant Neurology at BLK Max Healthcare. Delhi Emeritus Professor, National Academy of Medical Sciences. Former Director Professor at Janakpuri Super Speciality Hospital Society, New Delhi. Former Director Professor at Govind Ballabh Pant Institute of Postgraduate Medical Education Research, Delhi University. Welcome to our show, sir. It's an honor to have you with us.
Thank you so much.
Thank you so much. Dr. Arvind Sharma, Secretary, Indian Stroke Association, Board of Director, World Stroke Organization, Consultant Neurologist, Stroke Specialist, and NeuroSonologist at Zydus Hospital. Welcome to our show, sir. Really good to have you with us.
Thank you, Simran. Thank you very much.
Thank you so much, sir. Dr. Manoj Khanal, Director and Head Neurology at Max Healthcare Shalimar Bagh, Delhi. Welcome to our show, sir. Great to have you with us.
Thank you, everyone. Thank you.
Thank you so much, sir. Dr. Manish Mahajan, Senior Consultant Neurologist and Director at D Metley Clinic, Gurugram. Welcome to our show, sir. It's good to have you with us.
Thank you, VH. Thank you, Simran.
Thank you so much, sir. To begin with this session, we have lots and lots of interesting questions to ask about. But firstly, I would like to ask my question to Dr. Arvind Sharma as he is in flight and we have very few minutes with him so that we can get more and more insights from him. Sir, just to understand, we know that Alzheimer's and dementia means memory loss. Just want to understand how exactly it affects our memories. I mean, to understand more about it, where all these memories are stored, what type of memories are there, and how it impacts our memory out there.
Thank you, Simran. And thank you, Voice of Healthcare, for arranging this program on the very important day of World Alzheimer's Day, 21st September. And I definitely thank my co-panelists, Professor Mehndiratta, Dr. Manoj, and Dr. Manish Mahajan, giving me this opportunity to speak first. Thank you very much to all of you to be here. And Simran, a very important question and a very important topic in today's world, as we can see about the memory loss. See, we all don't remember things, right? We forget things. That is a blessing. That is normal, right? We don't feed everything. We don't remember everything. Whenever we see something, we remember the past events. So forgetfulness is there. But when it is benign, it is okay. But if it is pathological, that is the discussion for today about various type of dementia or the Alzheimer's. But I will talk about more about the memory, how the memory is stored in the brain. So we talk of memory in the three parts, that is the recent, immediate, and the remote. So these three memory types, the immediate type of memory is stored in the frontal part. If you ask you your phone number and immediately you reply, that is the immediate type of memory. Recent memory is stored in the temporal area, where it is a one part of the brain, where you ask a person to what he has eaten 2 days back, what he has done 1 or 2 days back. That is about the recent memory. The remote memory, that's stored in the totally in the cerebral cortex, and it is just like a computer, And you ask when is your birthday, when you got married, when you have the kids, what was the year it was done, that is the remote memory. So if you talk about all the dementias, generally the most important part which is lost is the recent memory and sometimes the immediate memory, and there are behavioral problems. So this is how we will answer the type of memory for you, and thank you very much.
Thank you so much for that response, sir. Thank you so much. Now, to move ahead with our discussion, I would like to ask my question to Dr. Mehndiratta. Sir, Alzheimer's disease and dementia are often used interchangeably by the public, but the medical experts know that they're not the same. So, could you help us clearly differentiate between dementia and Alzheimer's and explain why this distinction is so crucial for the early intervention?
At the outset, I would like to express gratitude to Voice of Healthcare for organizing this important event on World Alzheimer Day. Many people may not know who was Alzheimer. I'll come to that later. As you asked, often when we talk of dementia, we talk of as if we have got old age issue or we have got Alzheimer disease, which is like progressive memory loss and certain other features like how to do things, where I have kept, I may forget the way to the market, what I have given to the shopkeeper, I may forget to take the money back. So those are the things which fall under the umbrella of dementia. Dementia words come from ementia. Dementia is that when you have intellect and other, as Dr. Arvind mentioned, cognition, visuospatial, like going where is my bathroom, where is my kitchen? We remember those. So those things once lost is called dementia. D means it's a degradation in memory. So, but all dementias are not Alzheimer disease. Especially in our country, I will say vitamin B12 deficiency is one of the very important reason for dementia. The because many of us are pure vegetarian like me. Even I had very low vitamin B12 at one time when I was visiting professor in Kuwait. It was not done that time in India. I got it tested and it was very low. So that's one of the reversible cause for dementia. Reversible means which are easily treatable. So any neurologist, when patient goes to him or her, by the clinical symptomatology, we can find out it is okay, dementia. Now, is it irreversible, what was called as Alzheimer dementia, or reversible like because of low thyroid, because of vitamin B12 deficiency, diseases like cysticercosis, syphilis, tuberculosis, many other causes which are reversible causes, metabolic. We call them as metabolic and infective conditions. Now we can't say that Alzheimer disease is irreversible. If recognized early, I'm sure Alois Alzheimer, who described this entity on 3rd November 1906, 119 years back, must be happy to see there are good treatments available and it can be halted and reversed if diagnosed early and treated early. So all dementias are not Alzheimer. Around two-thirds are Alzheimer, especially after the age of 65. And but otherwise, a neurologist need to differentiate the causes which I mentioned by means of certain blood tests, EEG, and some specific tests to diagnose that it's not Alzheimer. And then also there are tests which confirm that this is Alzheimer disease. So there are advanced tests, advanced treatment available. I think my panelist colleague will further be discussing those things. Thank you so much, Simranji.
Thank you so much, sir, for answering that question and giving us this understanding of what is the difference between dementia and Alzheimer's and how it affects. Moving ahead with my next question to Dr. Manoj. Sir, if you can help us understand what could be the subtle early warning signs beyond just memory loss that families often miss, but one should pay attention to when it comes to Alzheimer's.
So, thank you, Voice of Healthcare, for giving this opportunity and this platform for creating awareness about Alzheimer's disease. Friends, over 8.8 million people they live with dementia in India above the age of 60 years. So it is a huge volume of patients, And the most important thing that have been noticed in clinical practice is the diagnosis. As we say in stroke, time is brain. So here also the time is brain. Early diagnosis in cases of mild cognitive impairment, mild dementia, as sir has rightly said about reversible causes, as B12 deficiency, hypothyroidism, autoimmune. So there are a lot of reversible causes, and those causes can be encountered. When a caregiver or when a relative comes to us, we ask him simple what happens to the patient. So most of the time they miss simple subtle signs. So when we talk about dementia, we have to keep in mind that initially it may start with forgetting names, appointments, but remembers them later on. The memory loss that will disrupt the daily life, forgetting recently learned information, forgetting important dates, asking same questions over and over again, and they mostly rely on their family members initially. And later on, there will be requirement of memory aids, challenges in planning or solving problems. There will be familiar recipes. Say a lady who is to cook a very good meal, she will start to forget those type of recipes that she was using, keeping track of monthly bills, difficulty concentrating, taking longer time than before, and occasionally the errors may be also happening in finances. Initially, there will be recent memory symptoms. There will be difficulty completing the familiar tasks like driving to a familiar location. You will forget that. Organizing a grocery list, which is always the person remembering the rules of a favorite game he likes. So understanding, and there will be confusion of time and place. Initially, you will lose track of dates, season, and he forgets where they are, and sometimes they go somewhere else and they tell that यहाँ क्यों आए हम. So they will get confused about the day of the week also. So trouble understanding visual images, vision changes may be also seen initially. Driving issues, there will be problem judging the distances. There will also be new problems with words or speaking or writing, stops in between the conversation. So this has to be noted. Struggle with vocabulary. Initially, you will have trouble naming a familiar object or using a wrong name, like you will call a watch a hand clock. So these sort of symptoms should be there. And there will be decreased judgment, misplacing things and putting things in unusual places. All this the caregiver has to note. And sometimes he will also accuse others that he has stolen it because it's kept in misplaced the things in the from time to time. Again, the most important thing is the initial withdrawal from his hobbies, the social activities, and feeling uninterested in family or social obligations. So these all symptoms initially the patient may have, and these are initially very subtle symptoms, and this has to be kept in mind. The most important thing is that sometimes the patient may present only with depression. He may be confused, suspicious behavior, fearfulness. No, he will be anxious. So these sort of symptoms may be initial symptoms of Parkinson's, dementia. So these all things has to be kept in mind. And the most important thing is that most of the time, early symptoms, all these early symptoms are missed by the caregiver.
Thank you so much, Dr. Khanil, for that sharing us the early signs and how we proceed for this, and we need to take care of it. Just want to confirm, Dr. Sharma, are you with us? We have another question for you.
Yes, yes, I'm there. Absolutely.
So, so, just to understand, since you spoke about the memory loss, so what practical steps can family and primary care doctors take care to ensure that patients showing early memory loss or behavior changes are referred to proper evaluation at the right point of time?
Very rightly said. It is, see, once someone loses the memory, so there are kind of viewers who understand both English and Hindi. शुरू में जब याद शक्ति जाने की तकलीफ होती है when they lose their memory, they don't know about it, right? It is the caregiver and the family who knows about it. They even don't understand what is happening with them. So at that time, that is known as in our type, I think maybe Dr. Manoj may have told that I missed that part. The minimal cognitive assessment, the minimal cognitive decline which happens in the initial part is a very important step where you should go to the doctor, and it is not like that patient will complain to you. It is on the caregiver and the family to identify and take to the neurologist and diagnose it early. If you diagnose it early, it's just like, see, any other chronic diseases are also controllable. If you see diabetes, you cannot eradicate diabetes. Those who are claiming that they can eradicate chronic diseases, That is a false claim. This is same for dementia. As you diagnose early and you control it and you've given them the drug and the proper treatment, they have a longer period of good quality of life. And it is not only important for the patient, but it is for the family, right? The trauma which they're going to suffer in the further stages. And that is why I'm to say that they have to recognize early and go to the expert and diagnose it early. That is most important. And there are various tests. And the first is I told you about the mini mental scale, which is there, and there is now a self-assessment MOCA, the Montreal Cognitive Assessment. They are in different languages also, which are available even in Hindi and other languages. Thank you, Simran, for the question.
Thank you so much. Thank you so much for that response, sir. Moving ahead to Dr. Manish Mahajan. So, firstly, I would like to mention that I have understood the importance of caregivers from you while we were together for an event. So, you equally emphasized on the caregiver as compared to the patient. So, from there, I understood how equally important it is. So, caregiving is often the hidden burden of Alzheimer's. So, what is the first piece of advice you would give to families when a loved one is newly diagnosed, and so they can prepare themselves emotionally and practically about the journey?
Yeah. Thank you, Simran, for this question. And thank you, Voice of Healthcare, for this opportunity to talk on this esteemed panel with my esteemed co panelists, Professor Mehndiratta sir, Dr. Arvind, Dr. Manoj. Regarding the question, I think, as you rightly mentioned, that here, when the dementia is there, the patients usually lack the insight in the problem. So, the caregivers, their role increases in the care for the or the treatment of the patient, because as rightly mentioned by the early features, not only they provide us with the information which helps us diagnose the problem, but for the management part also, because of the lack of the, you can say, the exact treatment which can at least halt the process of dementia or Alzheimer's, or reverse the process of Alzheimer's. We have more of non-pharmacological care, what we also call as tender love care, which is to be given by the caregivers. Not only this, as the disease progresses with the advancement of age, the role of caregiver gradually increases, because the independence with which the people with dementia usually move around diminishes, and their dependency for activities of daily living, they gradually go up. And so they have to take care of their feeding, their activities like bathing, changing clothes, because all of these faculties of brain which are controlled by different areas of the brain, they diminish with time. Now, pro, regarding the advice to the caregivers, now if this is the future, if this is something which we know as experts that it's something which obviously it is not coming the next day, so they have to have some plan in place, or they have to do some planning. So as you rightly mentioned, there are two important components of this planning: one is emotional and one is practical, because it's a really emotional setback for someone to know that someone, as Dr. Manoj Khanal said, that it could manifest as forgetting names. And when it comes to names of nearer and dear ones, they don't remember the names of their grandchildren, their children, then, or the spouse even. So then it becomes a challenge. So those blessings from the elderly they miss, and they feel the burden, so they have to be counseled. So what I usually do in my clinical practice is I sit separately with the caregivers, spend some time, first of all tell them that this Alzheimer's is what is the most likely diagnosis, and the once disclosing the, because it's more important to counsel them, to prepare them for the future. One, disclosing the diagnosis, then asking them to accept, give them time to ask further queries what they have, and ask them to read about it or come back with further questions, to so that they assimilate the diagnosis first of all. Then second, the most important thing is some practical arrangements. I tell them, please make arrangements, because most of the caregivers, they are product in their productive age group, so either they have to take, so this is the indirect, you can say, the cost which of dementia is there, because many time caregivers they have to go away with their uh, professions or their careers to take care of the people with dementia back at home. Now, as we are, Indian society is also moving towards nuclear families from the joint family concept. So we need to understand that the social support system which was there in place in yesteryears in India, which was very much there with the still with the rural population, but we face a lot of challenge now while dealing with the urban population, that they have to take certain arrangements, they have to take care of some support groups, or some there are certain organizations which provide some caregiver, skilled or semi skilled caregivers, so that they can take proper care and we can avoid what we call as caregiver burnout. Because although most of them are emotionally attached with the people, so as the time passes by they really feel the brunt, and either because of lack of involvement with their career, or with the financial losses, or with even physical burden which this care endures, this can pose a challenge for the caregiver. So this is the counseling which has to be done at the outset, and has to be done constantly separately with the caregiver at every follow up. Other things which are regarding the safety of the people, because many a times we have found that at you, there used to be a program in the from 20 years back, gumshuda, or you can find missing. So most of these people are dementic at times, because they can roam about, they can go away from homes, and they don't even remember what is their address. So now what we usually tell them is that give them some bracelet, steel bracelet, or what we call as the kada. So you can engrave their mobile numbers on that, contact details on that, so that if they're found, they can, or there can be cards which can be put in their wallet or pockets. Or now we have GPS devices also. At times people go in their societies to go for a walk, and they just move out of the gate. So you have to counsel the guards, take care, don't let them move out of the society. So all of these practical solutions, like, because you can't curtail their independence also, that is going to be a problem. So safety regarding the sharps, as Dr. Manoj Khanal said, that there could be behavioral changes as agitation sets in the later part of the dementia. That time you have to avoid all the sharps, you have to all the poisonous or this uh, corrosives you have to avoid for in the vicinity of the patient. So all these practical aspects have to be taught to the caregivers. Next is the financial planning. Many a times this direct and indirect cost, and as Dr. Manoj Khanal said, that people can forget about their financial, what they have, the bank accounts. So all these planning have to be there, and they have to be made aware that eventually they need to have the planning done now. Time is now, and they need support. They cannot do it alone. This is the core message which we discuss actually with our patients, and especially the caregivers.
Thank you
I
so
hope that
much, Dr.
answers your question.
Yes, sir, definitely. And thank you so much for giving us that practical tips which you actually discusses in your practice with your patients and the caregivers out there. Because these are few very minor things when it comes to, if we generally hear it, but it makes a great impact. And it is a every challenge for the caregivers to take care of the patients, of the person who is, diagnosed with Alzheimer's or dementia. So thank you so much for sharing those tips, sir. Moving on to my next question, Dr. Mehndiratta. Sir, in your experience, when you hear or counsel your patients, what is one of the major misconceptions about Alzheimer's that create that unnecessary fear or stigma? Because whenever it comes to Alzheimer's or dementia, it for a person who does not know much about it, it sounds like a something very big has happened and now there's no cure, or what to do now wala condition, right? So how do you address it in your practice?
Thank you so much. The discussion is going on very well, and very good points have been mentioned by all the panelists. The first and foremost thing, if I take Alzheimer disease, which occurs in two-thirds of subjects, it usually happens in elderly. That's the time when people start thinking he is doing knowingly. ये जान के कर रहे हैं, ऐसा है नहीं. तो ये चीज जो है, फर्स्ट ऑफ ऑल इज एक्सेप्टेंस which can come through the education of the society and advocacy, which can be in physical form by like doctors doing in groups, or through the print media and electronic media like yours, which can spread that this is Alzheimer disease is a disease. It's not that person is doing intentionally. जैसा कहते हैं कि ओल्ड एज हो गई है, ये तो ऐसे ही बोल रहे हैं, बड़बड़ा रहे हैं, कह रहे हैं वो मुझे नजर आ रहा है, वो सामने सांप बैठा है, वो मेरे पैसे चुरा के ले गया. So all these hallucination, delusions can occur, and these are not in the control of the patient, and they are genuine. First of all, we have to accept that. Second is telling them that now you have brought the patient to me, let me assess. He may have Alzheimer's disease or he may have something else. Now, there are 2-3 things which are very important, which we have not discussed so far.
Sure.
I discussed about thyroid, I discussed about B12, I discussed about infections, but I have not mentioned about the head trauma. Elderly are very prone to fall. They may suddenly hit while coming downstairs, they may hit the head on the wall, and nobody may notice. It may be subtle trauma, which can result in blood clot in the brain called subdural hematoma that needs to be ruled out. Second is head trauma in young people. That is one of the commonest cause in the younger generation, multiple head trauma while driving bike or otherwise, which can lead to also memory loss. So first is, I think Dr. Manish has very elaborately told that we need to sit with the family. We need to take a shared decision. Now, the patient won't understand. If patient has forgotten things, he has no remorse. Because it's not in his control. He doesn't know he's forgetting. But on the other hand, very important dementia is vascular dementia. Now you will be surprised now from where this sudden term has come. Vascular dementia is because of people who have got hypertension, diabetes, who are smokers, who have bad cholesterol, or who are taking alcohol. So those patients may have some changes in the brain, which also leads to memory loss, but these are called risk factors. And all these risk factors are avoidable, preventable, and we need to discuss with the family that as well. Suppose once we have ruled out all these causes and it is Alzheimer's disease, then we can discuss with the family. Now there are very good tests available. These are called biomarkers. Earlier we had very limited biomarker. Only one was, okay, let us get one MRI brain done or CT done. Now that era is gone. Technology is so advanced and we are at par with the world. In India, we have all the facilities available. Even biomarkers have been made available in our country by one company in conjunction with Japanese company, Agape. So now, earlier these markers were like clinical biomarkers, what we doctors judge. Then was MRI brain. Then now there are amyloid PET or special MRIs or PET scan done to confirm this. Then there are easy biomarkers. While doing a lumbar puncture from the back, we take a sample of the fluid of the brain called CSF biomarkers. Now the latest, easiest is taking sample from the blood. Now blood biomarkers can give you a good idea that this patient is heading to Alzheimer from mild disease, and that is the time when there are 2-3 interventions available that should be given. So all this discussion may appear little difficult for the general public, but that's what we wish to convey in simple words, that advancements have happened and family members have to be told. And what Manish very beautifully said, the responsibility has to be shared among the family members or caregivers. Now, many a time what I tell them, look, your parents have served you for ages, for 50 years, 30 years, 60 years, whatever. Now, he needs some service from you. So we have to serve him because he cannot look after himself and he is not aware of that. So all that, but then later I will come. If they have Alzheimer at home, what all precautions other than corrosive, what Manish mentioned, we should take care to make their life comfortable. Thank you.
Thank you so much, sir. Thank you so much for highlighting those important aspects and also mentioning again about what Dr. Manish said. I think those are very practical steps to be taken care of. And you rightly said the advancements. I think we all will agree that in the last 2-3 decades, the kind of advancements and AI upgradation we have seen in healthcare is tremendous. Because of that, there's a lot of scope which is there to treat patient, not only for the Alzheimer's but for every other kind of disease, especially the cancer also. But since Dr. Mehndiratta mentioned about the biomarkers, and now we are not only limited to MRI or CT scan for this, my next question is Dr. Manoj. So, we are talking about the biomarkers. So, how do advances like imaging, biomarkers, and cognitive screening tools help us identify the Alzheimer's earlier? And are these tests becoming more and more accessible for patients in India also?
Yes, yes, yeah, yes, because rightly said by Mehndiratta sir, that most important thing whenever we see the patient is two things. One is whether it is a reversible cause of dementia or irreversible. Why? Because rightly said by Manish that caregiver burned out is very common not only in India, outside also. As soon as you tell them that it is a irreversible dementia, they will back out, and even if the treatment is possible at those stages, most of the time they will say iska to koi ilaj hai nahi, and they will go home. So first step I do in clinical practice is that to make them understand that right now my diagnosis is dementia. I will see that whether it is Alzheimer's or whether it is a reversible cause. Now reversible causes, how do we ascertain the reversible causes? In India now there is availability of MRI, PET scan. All those scans are easily available. So MRI, particularly in Delhi, you can do an MRI, at least a plain MRI, which costs very much less if the patient cannot afford. In those cases, the most commonly what you will encounter is a vascular type of dementia, which we commonly see in our clinical practice. You will find multiple strokes that can be easily seen on MRI, and you can say that this is the cause that we commonly see. Second is subdural hematoma, particularly elderly patient. That also you can do an MRI or a CT scan. That is a neuroimaging marker. Third, tumors, multiple. It can be a metastasis or it can be type of tumors. Other is infective cause like neurocystic sarcosis, tuberculosis, syphilis has gone, but we can see herpes simplex encephalitis, Japanese encephalitis. So there are a lot of encephalitic illnesses that we have to keep in mind. In India, we have to more focus on first thing is reversible cause. If it is a post encephalitic sequelae, it can be a post head injury. Rightly said by sir, there's so many patients, they do not, though they do not wear an helmet or they have a road traffic accident, they have multiple head injuries. That may be one of the cause of your dementia. So these all causes can be seen by the help of a clinical judgment. Second is by the help of imaging, which is advanced in the form of MRI. If you don't get anything in the MRI or you get only a medial temporal lobe atrophy, which suggests that it might be Alzheimer's, then we can go for further scans like the PET scan. So in PET scan, we have two types of PET scan which we commonly do. One is the FDG PET, which is easily available, where you can get areas of low brain metabolism and helps to differentiate what type of dementia it is, whether it is Alzheimer's. Now we differentiate two types. One is Alzheimer's or non-Alzheimer's. And second is the amyloid PET, as the sir has rightly said, in which we can judge the amount of amyloid plaques in the brain, which is the hallmark of Alzheimer's disease. If you can do an amyloid PET, then you can say that yes, this is an Alzheimer's disease. But first step is reversible, then we went for the irreversible step. Third is the most important thing is the biomarkers. Now to confirm the diagnosis, we can do two things. One is we have CSF sample we can take, we can do A beta 42 or total tau protein in the CSF, that we can see. Second is we can go for neurofilament light protein and genetic marker. Most importantly is the ApoE gene. Those who are at increased risk for Alzheimer's disease, that we can find out. Now, if there is presence of amyloid plaques, that is a marker, key marker for Alzheimer's disease, and we can detect it early. in the stage of MCI, that is the minimal cognitive impairment, as I have said, that they may be presenting with initial symptoms, which may be misdiagnosed as aging or malingering, ऐसे बोल रहे हैं जैसे sir was telling. That stage we can use these biomarkers and then we can tell the relatives ये हमने टेस्ट किया है, इस पे आपको ये डायग्नोसिस हुआ है, clinical judgment. And another most important thing is the cognitive tools, as was earlier highlighted, that there are certain cognitive tools. Simple tool is an MMSC, that is the mini mental status examination. You can do it in 2 to 3 minutes. This test, or you can go for a Montreal cognitive assessment or a mini cog, where you can use a clock diagram and a simple memory recall test. This takes hardly 1 to 2 minutes. So this test will give you a clinical judgment, as we can judge on the basis of the mini mental status examination, whether it is a severe, where it will be more than 20, the scale will be higher, till 30 we do. It is mild, it can be below 8, and moderate around 8 to 20. So most of the cases we have to determine whether it is mild variety, where the treatment has to be started early. Once it reaches the severe stage, then only the one thing that we can do is we can start the treatment. But the most important part is what Manish was saying. In the advanced stage of the disease, most of the patient which land up with neurologist is in the moderate to the advanced stage of the disease, where the disease has already progressed. So we have to balance between treatment and also caregiver. We have to see whether they can afford all those burnt out things and all those explaining to the patient. And most important thing which I think we should be highlighting is there has to be a dementia clinic. It is not possible in a general clinic to see a patient with dementia. Why? Because he needs not only care from the patient. We does not diagnose. No, we diagnose a stroke, we tell him this is the area, we write that. Not possible with dementia, because here we have to give time to the family members. We have to give at least double the time you are giving to the patient, because examination findings you have noted, you have to give time to the caregiver, you have to explain him everything, that I have seen this is the treatment possible and this is the thing that has to be done at home. So I think dementia clinic, particularly like we do for stroke clinic, headache clinic, we should have particularly dementia clinic. And you have to allow time. Say you see only 3 patients, 20 minutes at least for per patient in 1 hour, then only it will be possible to give justice to the patient. Thank you.
Thank you so much, Dr. Manoj, for answering that question and highlighting that important points, that it requires a time, it requires patience, and I think to give justice to the dementia patients and the family, they need a lot of time. And like Manish sir also mentioned and highlighted that caregiving is one of the most important factor when it comes to Alzheimer's or dementia. So I think that is more important. So moving on to my next question, Dr. Manish Mahajan. So when we talk about Alzheimer's, do you see that there is this overlap between the vascular risk factors like hypertension, diabetes, or stroke, and the development of dementia? And can addressing these risk factors actually prevent or delay the Alzheimer's?
I think, Simran, this is the most important and the valid question when it comes to what we call as prevention of dementia, right? As rightly highlighted by Professor Mehndiratta sir, and elaborated further by Dr. Manoj, that there is a component. That means if you do an MRI, you see vascular imaging, you see the vascular changes, you label it as vascular dementia, right? But the most important understatement is most of the dementias, they have some component of neurodegeneration. That means there is a loss of connections of the neurons and the neurons themselves, and there are some vascular changes. Now the components, the largest component of dementia is what we call as mixed dementias. That means they have a vascular component to it, silent strokes, which Dr. Professor Mehndiratta sir told, Dr. Manoj told. And so you will have even people who have features of Alzheimer's, but they will have vascular changes on MRI, or people who have suffered stroke in the past or suffer from vascular dementia, they will have microscopic or amyloid changes, what Dr. Manoj Khanal mentioned, on histopathology, or if you take a brain biopsy in these people. So the mixed dementia, and there are a number of studies to endorse this concept. Now, when we talk about these risk factors, why are they important? Because These are the factors which we call as modifiable risk factors. If you and most of these risk factors are lifestyle associated. So as these lifestyle risk factors are increasing day by day, younger population is more and more affected by this. So the more population is getting at risk of developing dementia. So if the vascular component, it can be prevented, the vascular pathology can be diminished, you can diminish the risk for development of the dementia. Now, here, if we enumerate what are the modifiable risk factors, as you rightly mentioned, hypertension, diabetes, dyslipidemia, Dr. Mehndiratta sir also told bad cholesterol. Then it is the obesity. All of these we call as metabolic syndrome. Okay. One important another factor which is associated with again obesity is the obstructive sleep apnea. I always talk about. Now, if we talk about these risk factors, in every patient of Alzheimer's disease, these risk factors should also be what we call as comorbidities. They have to be addressed. Number one. Second, for all the reversible factors like B12 deficiency, thyroid disorder, they should also be looked at in people who feel they look like Alzheimer's. So in degenerative dementias, there is still a role to look into these risk factors and address them so that whatever is modifiable, reversible, preventable, that can be catered to. So you need to be very clear that not only independently in people who have degenerative dementia, these factors are equally important. And slightly touching upon obstructive sleep apnea, snoring is an excessive daytime sleepiness. These are the two important complaints which people tell. And snoring is usually equated with good night sleep, which is the other way around. Snoring leads to poor quality sleep, disrupted sleep, and thus affect your cognition because brain is not able to take rest, adequate rest, and memory gets consolidated during sleep. Your and you run additional risk factor of worsening of your obesity or your hypertension when you snore because of the lack of proper oxygen to other vital organs like heart and brain. So that is something which I need to highlight, that control of diabetes, control of your uh, blood pressures, cholesterols, with regular engagement in regular physical activity, dietary modifications, getting your B12 and thyroid checked and corrected is equally important. I think thank you very much for asking this important question.
Thank you so much, sir, for that question. And I think we normally do not take it very seriously, our sleep, and we mostly compromise on it. We may have our meal while working or over a call or doing some work. We have it, and I think now today's generation are normally people are very busy, so they just focus on the work, commitment, and the deliverables. And the most compromised factor is sleep, and you just explained us how important it is to pay attention and how it can lead to other major major diseases. uh, Moving on to my next question to Dr. Mehndiratta. So we discussed about the disease, the breakthroughs, how we can diagnose it early, and for the caregivers. But since we're talking about this for the awareness, for the education, for our general public, so if I have to understand that, what kind of awareness campaigns or community initiatives do you think are the most effective in normalizing the conversation around dementia? If you could tell us, because you know, come across various patients, families out there when you treat them. So, what do you think is the most effective practical step here?
Excellent question. And we have wonderful discussion. What Manish, where he finished, I will just say one line for that good sleep is the panacea of good health. Good sleep is the panacea for the good health, whether it is any organ of the body, number one. Number two, reversible factors, what the public should know also. There are two types of early stages called minimal cognitive impairment or mild cognitive impairment. And very important component is vascular cognitive impairment, where this hypertension, diabetes, smoking has become a fashion. Alcohol. In my office, there is there is a quote I have put on the wall, and I show to most of the patient is, your diet is your bank account, and good investment is the strategy for your future. So these awareness programs, like every day I do in my office, my colleagues do. Second is doing with the groups. If similar type of illness people have, like forgetting or those things, getting 8 to 10 people in a boardroom with the family discussing, they will be our messengers in the society. They will go and tell in their mohalla or village or wherever it is possible. The next is the education and awareness. Like few years back, I did in Rotary Club, giving a talk on Alzheimer and showing the video of the patient who had dementia and their family members telling. One lady said it was so emotional, my papa has got forgetfulness. उनको अब याद नहीं रहता, इससे हमें बहुत दुख लगता है. So that was so emotional, and it is touching the chord with the other patients, other audience, and they are again the messenger. Next messenger, this may be at local level, this is not very large thing. The most is coming through the, like Alzheimer Day. Today also in the newspaper there was something mentioning in the print media, which will be read by lakhs and lakhs of people or millions of people. And it should be in local vernacular as well as in the international language. Both are required. Not only that we do only in English. The third one, which is very important, is a panel discussion like you are doing. Maybe thousands of people are joining on YouTube, LinkedIn, or Instagram. They will
Facebook.
get second Facebook. Yes, sir. Thank you. And similarly, you can also like put this on YouTube, which in free time people can see and get benefited. We have number of videos like this. Dr. Manoj will have, Dr. Manish will have on the YouTube, by which patients see, and then they come, oh, maybe we have this, and they come to the doctor. Next is print media, electronic media, and very important these days is social media and the live program like this. So we should also tell them that please consult the real doctor. Avoid consulting the Google doctor, Dr. Google, or other AI doctor. I always tell my colleagues, my residents, my students, and myself that this is the natural intelligence which God has given us, supernatural power has given us. And this has made artificial intelligence. So even if we have to get MRI, amyloid PET, biomarkers, first is spending time with the patient. Because these days, doctors are short of time and patients are very short of time. Invariably, they will bring a bag full of black films. डॉक्टर सब कुछ करा लिया, 2 मिनट लगेंगे, जरा आप बता दीजिए क्या है. So I said, please keep it. Let me apply my mind, what nature has given me, make a diagnosis, and then tell you what are the tests required. Not that just go MRI, B12, thyroid, and all that. Those may be required. I'm not saying not required, that I don't get. So it's better to do that. The other thing which I tell family, anyone who has got early dementia, please give him company. And also his room should be well lit in the night. Very important. And it is better if he can sleep on the floor, on a cushioned bed, rather than on the bed. And the next one is there should be a big calendar in the room so that he or she can see the date, time, and a wall clock. So those things are becoming obsolete because of mobile phone, but it's very important to have those. And many people ask, sir, what should we do? Should we go to a counselor? Should we go for cognitive behavior therapy? I said, that's very important, but do that at home also. Let him listen to this music, songs, religious songs, and then ask him, what was this? Can you repeat this? Yeah, many elderly may be more committed to religious songs. The other thing is, I ask them, let them watch the TV of their choice, the channel. And then there are footnotes. Then ask them, you read these footnotes and remember and repeat once it's over. So these are small, small points, but these are practical points which I have learned over a period of time and I convey to my patients. These are very useful. So it has to be multi-pronged approach. It is from bottom up approach, not up top to bottom approach. So in the clinic with the doctor, in the groups, then in the social media, print media, electronic media, and effort in this direction of uh, organization like yours is tremendous. Thank you so much.
Thank you so much for those kind words, sir. And it is your response is very important, and it has so much of learning points in it, sir. From the smoking point, from the food habits, from just like you said that normally patients do not have that much time. They are in a hurry more than doctors. And I guess I can relate to the point where Dr. Manoj said that we need a separate hospital for dementia, for Alzheimer's, where they can separately treat those patients, a dedicated hospital for this. And
Can I come
sir,
in, Simran? Can I come in? Around
yes, sir.
15 or 20 years back, I have visited Japan because Japan had the longest average life expectancy. And there were Alzheimer homes, Alzheimer home, because there are not family members to look after. But that was like a family atmosphere. Similarly, we have elderly homes here, senior citizen home here, but they all need to be fully equipped and trained to give love, affection, and tender. What Manoj said, it's a non-pharmacological treatment, but in view of nuclear family, very important. And we are also getting now Alzheimer homes in our country because average life expectancy even in our country is around 72 for women and 71 for men, or around 70 plus. So that's very important. And we are also having 11% of elderly population in our country. And by 2050, we'll have 19%. So if you think of 140 crores, you can see 20% will be 28 crores. Huge, huge population, which most of the parents come to us who are elderly. The first thing they said, they don't tell their symptom. First thing they tell doctor, हम अकेले हैं. We are alone. Kids are in Japan, China, or USA or Canada, and it's becoming difficult. Then they will start telling and later often their eyes are wet. So from all those points, we have to take care. Future strategy, doctors, media is very important, but similarly, policy decision by the government planning is very important. As you must be aware that now there is a Ministry of Loneliness in UK.
Yeah.
People are lonely, whether young or old. So there are ministries for loneliness, and it's happening all over the world. So this needs to be taken care. Thank you.
So very rightly pointed out. I think the points you have mentioned is directly coming from your experience, from your expertise, which you have, built that. So and thank you so much for sharing all those things with us. It is a very learning experience for us also. Moving on to my next question, Dr. Manoj. So, since we're talking about the prevention of Alzheimer's, so should genetic testing be recommended for families with a strong history of Alzheimer's, and how should we, handle all those sensitive results?
Yes. So the most important thing is when we talk about reversible causes or irreversible causes, we have to take in account that one thing we forget is it can be a familial or a genetic cause. Like in cases of tremors, we have one variant known as SCA12 variant, which happens in Agarwal families. So most of them we do a test like the SCA12 test, and we find that it is positive, so that counseling and other things are required. So that familial or genetic component has to be kept in mind whenever we talk. And I said in my biomarker, one marker we can do is that of an ApoE gene. So that gene marker, if it is positive, it indicates that the patient may develop later on and form of Alzheimer's disease late onset, which can be after the age of 60 years. That biomarker test can be done. But the first important thing is that you have to diagnose whether it is on the basis of that. Second is the lifestyle factors and other factors has to be kept in mind, as was rightly said, like in the form of, sometimes most of the time what we get is dementia which is multifactorial.
Mm.
Multifactorial means the patient may be having an underlying disease which is in Alzheimer's, maybe a familial disease. On top of that, he might develop subdural hematoma or a hyponatremia or something else. So this is usually multifactorial. So in those cases, we have to ascertain everything and then go for the genetic test. Second is to explain to the caregiver. We have to give time. So once we have diagnosed that it is an Alzheimer's, then we have to see whether it is a sporadic or a genetic cause. So genetic means familial. So we have to ask regarding the family history, the family tree, whether somebody else is suffering from that disease or not. Then we have to proceed very carefully and explain to them that this might be a familial cause. We are planning that test. So that way we can proceed. Second way is we rule out all the reversible causes and then find out that we can go for this genetic test. So it is very important that you spend time first of all with the patient, then the family member. That requires around hardly 15-20 minutes of all ascertainment, and then you gradually explain to them in a very, very polite way. Usually what happens, doctor के पास time नहीं होता, लिख देते दवाई लो जी जाओ. So that sort of thing cannot be done with dementia or Alzheimer's patient. So that requires time, and then only you explain, and then they will go ahead with the test.
Really rightly pointed out, sir. There are some specific cases or diseases which needs a lot of time and care from the healthcare side, and especially more from the patient side. Like Dr. Manmohan said, कि normally patients ज़्यादा जल्दी में होते हैं doctor के comparison में.
And I
So
want
I
to
think
add one more thing. Doctor is not always the culprit. What happens is that whenever there is a rush, the the caregiver actually has burned out. As rightly said by Manish, he will come inside. हमें पता है इनको Alzheimer's है, ये फिल्म है, आप देखो इसको, आप diagnosis तो हो गया है, आप इलाज बताओ कुछ नया है कि नहीं? What will you do? So that sort of thing always happens in clinical practice, particularly in India or third world country where you are very busy with all types of patients. So
yes.
for that case, what we need is, as I rightly said, is dementia clinics where specifically you say that I will see only 3 or 4 patients in 1 hour, and this is the time you need to come with all the reports. I will see the report, I will give a second, third, whatever opinion you come forward, and then I will give a proper treatment. So that is the first role that the doctor can play as a neurologist or as a dementia specialist. Second is geriatric care. Sir has rightly said, outside countries they have now started Alzheimer's clinic, all those things. In India, it is a new thing, that is geriatric. We started geriatric medicine in, AIMS, but the geriatrician, that is MD geriatrics, what they call it themselves, is very much rare in India. So they play a very critical role for ascertaining this type of patient and then referring to the neurologist. So that way, 50% of the work of the neurologist is done.
Very rightly pointed out, sir, and thank you so much for that response. Moving ahead, as we have come to close to our session, my last question is Dr. Manish. So, Dr. Manmohan pointed out that today we have 11% population of elder people, and by 2050 it will be 19%. So there will be increase of population of elderly people, and I think we need more and more of such elderly homes, advanced techniques, better care options, as we are becoming successful in terms of technology wise, in terms of India is growing, right? So if there's one immediate change you could make in India's healthcare system for Alzheimer's cares, what would it be, sir?
Yeah, so I think Simran, this is a very futuristic question which you have asked me. Mm, there would be no ideal answer for this because the things are evolving, right? This is something which we might not know what will happen tomorrow, but as of the current tools which we have with us, so I think with the current technology, what we can work on is to work on the how we can improvise, or what Dr. Manoj Khanal highlighted, the advancements in the diagnosis. That means the tools which can, or they can be more made more accessible. As sir highlighted, this is a policy matter as well. As more and more people will be uh, being at risk of running for dementia because they are aging, we need to make the diagnostic this avenues available, accessible to most of the people. Now, talking about the technology, it can play a lot of role in the management. Like sir mentioned about the cognitive training. If we talk about there are number of, because see, to decrease the rate of decline in the cognitive functions, you can learn new skills. If somebody knows how to paint, they can still work on their calculations. If somebody can work on their sudoku, they can perform, or what social interactions can be increased. So as and as although we are improving, or you use the word successful in technology, but we are going away from socializing. Sir highlighted that value, Dr. Manoj highlighted that value. So that spending time within the family, with your friends, with your nears and dear ones, because the loneliness, the social withdrawal is actually not a, it's a rare burden for the dementia, because not only this increases your lifestyle issues, and it also increases your chances of depression, which is a very big comorbidity for dementia. So what tools we have, we can use rather technology to our use. One, we can use this to conduct because many times these patients cannot be transported. They restrict themselves to be transported to the health facility. So as Dr. Manoj Khanal said, one, social media can be used to disseminate the information, awareness about these disorders. Then teleneurology or telecommunication can be used to get in touch with at their own place in the environment. You can assess what support system they have. You can guide them, or your team members like your counselors, your physical rehabilitation team, they can guide them what changes they can make in their homes, like simple things. As they mentioned, falls can be prevented, subdural hematomas can be prevented. So simple changes like putting bars in the bathroom, guiding lights are talked about, illumination while in the night time, so that this again prevents falls. Then all the changes in the rooms, these can be guided to those people. I told about sudoku, so it can be paper based, or it could be computer based or tablet based. But the bigger challenge is the rural urban divide, the availability of the networks, the availability of the accessible, the Dr. Manoj said we are talking about Delhi, we are talking from Delhi NCR, but the things are not the same pan India. Even
Yes.
still, we don't have adequate, optimal MRIs available, or the awareness about the dementia. So this type of panel discussion, this information goes a long way. Many of, as Dr. Manoj, if you remember one of his line, most of the people which we see are in the moderate and the advanced stage. They don't come to us with early features. Why? Because either they miss out, lack of because of lack of awareness, or they are hanging out with people who are not experts on treating dementia. Because dementia is a neurological disorder, it's not normal aging. Sir has already reiterated this, that just because of age people say ये तो अब बुजुर्ग हो गए हैं, ऐसा करना लाजमी है, ऐसा कर हो सकता है, ठीक है. So we accept that no, you should not. Dementia is a pathological process. You have to remember it's a chronic neurological disorder. It's not normal aging. So please, this has to be underlined. You can use this technology for awareness, for diagnosis, for dissemination of the correct information in the correct way to the right people where they need it the most. That's what I think this uh, new technology has to play a role, and the future lies. Maybe some, again, some very specific biomarkers come up, very again some technology comes up where they can assist in, uh, because the most important aspect in medicine is regenerative medicine or rehabilitative medicine. That is the way forward, and we would like to see that future in our lifetimes only, to or in we, so that we can offer it to our people with dementia. Thank you.
Definitely, sir. And thank you so much. We look forward for more such advancements. And like you said, technology should be used for the dissemination of information and to educate, to analyze, to detect, to diagnose. But when it comes to the patients, we need more and more socializing. We need people around so that they don't feel lonely. Yes, sir.
Simranji, I think we are over
Yes.
time.
Yes, sir.
One or two things I will like to mention that dementia is more common in rural area than urban area. Because in urban area, you are interacting better, you are involving yourself better, and you are educated better. So one is that aspect. And second is an entity which we have not discussed, maybe for the elite educated people, is B-clouded dementia. B-clouded dementia is people get some infection like lung infection, or doctors are prescribing some medicine. So doctor also must check his or her inventory before labeling it as a true dementia. It may be because of certain drugs I will not name, not to confuse the public, which can also cause clouding of consciousness, poor alertness, and poor registration, which may be interpreted as not remembering the things. So, in my opinion, all those aspects, not straight away do that. I always say drugs, doctor, diagnosis must be introspected by the doctor themselves also before labeling it that it is a true dementia. Thank you.
Thank you so much, sir. And now I thank all my panelists present here for this highly valuable discussion on Ask About Alzheimer's on the occasion of World Alzheimer's Day. That was an enlightening conversation. And we learned so much about this, about caregiving, about the practical tips and advices from our experts. How can we tackle this together? So thank you so much for taking time out of your schedule and sharing those insights, expertise with us to create that awareness and education. It means a lot for us and for all our audience. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.